Hi everyone, I am Dr. Atar Rahman Khan, consultant internal medicine. Today I am going to talk about the difference between dengue fever and COVID-19 fever. COVID-19 incubation period is 2 to 14 days, means that if one is exposed to the infection, there is a window period of 2 to 14 days to get the symptom appear or do not appear. Even patient is infected, patient may not demonstrate symptoms. The similarity is the incubation period is same and both are RNA virus. Dengue fever and the COVID virus is RNA virus. COVID virus has a lot of variation in their mutation, but dengue also may have mutation. We don't have too much of scientific study about dengue fever. But there are four kinds of dengue fever, dengue virus, dengue A, dengue B, dengue C, dengue D. So if one is infected with dengue A, he will not be infected with dengue A again. He can be infected with dengue B or dengue C and D. So there are risks if one is infected by dengue A. He or she will be at risk for infection with dengue B, then C or D. So that person will be exposed to the virus when the person is bitten by a mosquito called Aedes aegypticus, and the vector is Aedes aegypticus or for dengue. But for COVID, vector is you and me. If I have the infection, I can transmit the infection to you and others. If I sneeze, cough, speak loudly in front of you, within 6 feet distance, and do not wear any surgical mask or any protective mask. The dengue fever is potentially fatal. It can cause dengue hemorrhagic fever. It can cause dengue shock syndrome. And it can kill, but it is less fatal than COVID virus, I would say, because most of the dengue fever patient, 80% people, they don't have symptoms. They even don't know they have dengue. Same thing in COVID-19. Suppose a patient is infected with COVID-19, patient even do not know. I saw a patient yesterday, he said that he is just exposed to COVID-19. He thought that he should do the test and he did COVID RNA test, and guess what? The test is positive. He is very honest. He said, I don't want to transmit the virus to the others because people around me know that I don't have any symptoms, so I may not have any COVID. Dengue also same, but dengue patient does not need any special protection except that a mosquito protection is needed. Mosquito protection, as you know, that the dengue patient, those who is infected with dengue by diagnostic study, then he should wear full sleeve shirt and full pant and socks, full pant tucked into the socks, and wear cap or hat while they go outside, especially in the dusk and dawn. Dengue is a tropical and subtropical disease. It is also a pandemic. It is prevalent across the world. Almost 3 billion people is at risk for dengue, like half of the population. But COVID, I would say 8 billion people, everybody is exposed to, everybody is potentially at risk for COVID virus. In COVID, there is a variation in clinical features. The clinical features can vary from sore throat, fever, new loss of smell or new loss of appetite, joint pain, muscle pain, diarrhea, rash, headache, and also multiple symptoms that we cannot describe it here. But in dengue, usually few symptoms like severe headache. All on a sudden, the patient might have a fever, high fever, and it is called bone fever, because your muscle and bones are aching so hard that it looks like that your bone is going to be broken. There is a severe pain behind the eyes. There is a severe pain, frontal headache. There is severe pain around the neck and in the joints and the muscles, and there can be a rash. In both scenario, dengue and COVID, there could be a rash. But in dengue, there are a lot of rash patient may have. Patient may have epistaxis or bleeding in the nose or bleeding in the gum. And in both cases, platelet count go down, but in dengue, platelet count goes down more than the COVID virus. So there are a lot of dengue patients who may need COVID, who may need platelet transfusion, but there is no incident of platelet transfusion so far for the COVID-19 patient. So this is a basic difference I have discussed right now with you, and in the future I will try to elaborate the difference. I want to make it short. Thank you so much. I hope you have enjoyed my video. If so,